everybody. This is Dr. Lori Shemek.
And I'm Omar Cumberbatch. You're listening to This Podcast Burns Fat. Hey, Lori, how are you today?
Hi, Omar. I'm doing wonderful, aside from some technical glitches.
I know, it's all good. I'm glad
I tell you.
Yeah, no. This is just, technology is not always reliable, as we know, and I'm just glad you're able to call in and we actually hear a little bit of your voice. And we'll, obviously, when the show starts, you'll be back to normal sounding Lori.
Right. Yes. And public service announcement, she is not sick.
That you are not. Yes. So today we have an amazing guest in Dr. Tom Ingegno. And I love when we have topics that are new and unexplored, as at least in our particular podcast. And this is the art of cupping.
I know. Isn't that something? I've heard so much about it, but I really didn't know anything, not much about it.
Yeah, no, and I think he does a wonderful job explaining all the details about it. And I'm actively looking for someone to do this particular service on me. I'm really fascinated by it. And I thought once anybody hears the way Dr. Tom explains it, they're going to be all for it as well. And I'm really excited to share him with the audience. So, yeah, let's jump into it.
Yeah, I love it. And so will the audience.
All right, here we go. Hey, Dr. Tom, welcome to the show.
Hey, thank you so much for having me.
Hi, Dr. Tom. It's so nice to have you. Appreciate it.
I don't get to go on too many shows about weight loss or fat burning, so this is an interesting one for me.
Well, our audience likes to optimize their health as well. So
this is all part of when we say I'm an acupuncturist, right? That's the license, but the practice is East Asian medicine as a whole, and they have this concept called Yangshen, which is like nourishing life. And that's every aspect. So that's not just the things you do in a clinic, right? You come for the acupuncture, moxibustion, cupping, gua sha, all those techniques. And a lot of those things, other than the acupuncture, are often done at home. And that includes diet, exercise, meditation, qigong, which is breathing and moving meditation, and even body work. There's a lot of folk medicine that has a lot of clinical value. And if you can put that in the hands of people, right, you're empowering them to have a healthier life. So, we want to burn fat. We got to change our diet. We got to move more. But what are we doing to make sure our body can recover from the workout we did and keep us, at optimal health in every aspect of life? And sometimes they'll translate, and this is a not a proper translation, that Yangshen into enjoying old life or aging gracefully or something like that, right? So we don't have to be, a victim to time, if you will.
So, Dr. Tom, how do you stumble into this, especially coming from your traditional Western medicine?
Yeah. So I was all geared to be, I wanted to be an MD, right? I thought that's how I was going to help people. And, through a series of events that I always use the word serendipitous, like I couldn't have done this, intentionally, let's say. My junior year of my pre-med undergrad program, I got a postcard in the mail from an acupuncture school that was having an open house during the winter break. And I went to that and came home with the paperwork, filled it out, and I was enrolled the second semester of my junior year in my graduate program. I had enough, undergrad credits to get in. That program was going to give you a bachelor's in professional health science and a master's in acupuncture, which at the time was the end degree. It was the highest degree they gave acupuncturists. They also wrote it at a doctorate level saying, oh, we'll grandfather you in and give you the doctorate when it comes available. But because, all colleges are pretty much for profit, they were like, no, you got to go back. So they got me, well, another school got me for the doctorate, or at least should I say my money. But within that, it's been such a rewarding career, and all the issues that I was having with Western medicine, where it's like, you walk in and you talk to the doctor for 2 minutes and like they're already taking notes and walking out the door. This medicine we get to spend, my treatments are an hour long. The first one's an hour and a half, and a lot of that is to fill out this extensive paperwork, which covers what we call in Chinese medicine the classical 10 questions. That's everything from bowel bladder function to body temperature to, if you're a female, your menstrual cycle, sexual health, mental health. And that all helps us diagnose a person as a whole being rather than just, hey, I'm here because my shoulder hurts, or I'm here because, I get a lot of cramping during my period, or, I just haven't been sleeping. So we want to look at that as a whole body view. And I think, especially now, especially after COVID, shows like this are so important because people are trying to look at all aspects of their life. They want some control over their health. This isn't a situation anymore where, the person with the white lab coat is going to tell me what to do or write something on a piece of paper, and I'm going to go take a pill and it's all going to go away. We know that's not how it works. It's never how it worked. It wasn't working when we did that. And now we have to change how we act. Now we have to change how we view our health, and we have to have that global view. And
Absolutely.
that comes down to our relationships. That comes down to society as a whole, right? We know that, if the person next to me is sick, that's not good for me. So in a very selfish way, having this social aspect to health is very important to us.
Yeah. And, and that's really well said. What you do is more of a holistic
Yeah.
approach.
Yeah.
And within that, there is something that there is a practice called cupping.
Yeah.
That many people aren't aware of. And what's so funny is I was watching a movie last night with my husband, and it's The Madness of King George, I think is the name of it.
Okay. All right.
Yeah. And in it, they were cupping, and I couldn't
Yeah.
believe it because we were having you on the show today.
Well, that's another act of serendipity there. That, like,
Yeah.
how's that going to happen? I have that happen to me all the time, where it's like, oh, I read this article this morning, and then a patient comes in and starts talking about that.
Right.
But cupping therapy, it's so funny where, like, it's been around longer than acupuncture even. And it's not even from Asian medicine in its roots. We're not sure where it's from. Somewhere it was either Persia, Greece, Egypt, and ancient Egypt has the oldest text on it. So we know it was being done before they wrote it down. This is going back 4,000 or 5,000 years, and one of the great things, and one of the reasons I wrote a book on it, was because this was done in households before you went to the physician. And with modern tools, like, traditionally we were doing what was called fire cupping. We still do that in our clinic, and you run fire on the inside of a glass jar.
That's what you doing in the movie. Yeah.
Yeah. And that was grandma's medicine. Grandma always did that, and it didn't matter what culture you were from. It spread around the world before the silk trade route was even called the silk trade route. So many families were doing it, and now with this focus on, like, it's not just the number on the scale, it's not just the blood work, but how am I feeling, to be able to return something like that to the hands of the people that are like the family healer, if you will, was really the mission there. It's like, I can only treat so many people in my clinic, and knock on wood, I have an amazing staff. We have 3 other acupuncturists, and one of my technicians is actually in acupuncture school now. I'm super proud of her. So that's going to be 5 acupuncturists. Even if we were booked solid and we all worked 7 days a week, we're not even scratching the surface of the population of Baltimore. And if we want to have some global impact, my tiny little book, that seems very arrogant of me to say, but hopefully we can add to that. We can help more people, and empower them to take care of their own health better.
So can you describe exactly what it is for those who aren't?
Yeah. So the nuts and bolts of it, the easiest way of saying it is it's creating a vacuum. So negative pressure on the surface of the skin and adhering a cup. Traditionally, it was even buffalo horns or clay pots or sections of bamboo. where they would burn the oxygen out super quick and put that on the body, and that little vacuum would then pull the skin up into the cup, right? So the marks that we see are the capillaries underneath the surface of the skin breaking. It's a hickey, for lack of a better
Right.
term. But what happens below the surface there? So that skin's pulled up, the fascia's pulled up, and then you create this void. And since it's a closed system, the blood that's deep in that tissue gets pulled to the surface. You're creating a little bit of local inflammation, but you're increasing circulation systemically. So you're getting any metabolic waste, any inflammation, the cytokines, the lactic acid, all the stuff that's stuck in that tissue that's not getting the best circulation now is getting fresh blood pulled in and flushing out that old tissue. Now, all the stuff that kind of comes to the surface, or that interstitial space between the skin and the fascia, then gets reabsorbed by the lymph and is able to get broken down and disposed of properly. But now we flooded that tissue beneath it with fresh blood, right? So we have this physical thing. We can use it for musculoskeletal pain, but that tissue, that effect goes 6 inches deep. So classically, we would use it for respiratory disorders. We could use it for digestive disorders.
Wow.
And the other thing that I love about it is the mental health aspect, right? I put the cups on, and maybe I'm a little sadistic in the clinic when I do cupping. I want it. I want you to feel it. I want it to be strong but tolerable, right? So oh wow, that's a little uncomfortable. After a couple of minutes, because of that blood circulation, those cups feel softer. I come back in and those patients are snoring, right? So there's this like relaxation effect, right? And we know we're stimulating, we're playing with the vagus nerve. We're getting you out of fight or flight and putting you in
Oh,
rest and
that's interesting.
digest.
And
You
that's
know,
an important point, the vagus nerve.
yeah.
Yeah, most people don't understand that it plays a huge role in our health.
Yeah, absolutely. I mean, the vagus nerve, vagus literally means wandering. It comes out of the cranial nerves and, touches our immune system. It touches our digestion, our respiratory system, our cardiovascular system. And if we had good vagal tone, we know our heart rate is, that our heart rate variability
Mhm.
improves, our respiratory rate slows down, but we're taking deeper breaths. We're out of that fight or flight. And that's when our body heals itself. That's when our cortisol levels fall, which is one of the many reasons people hold weight.
So, um, for example, if
Yeah.
somebody has knee arthritis, would
Yeah.
that be something that cupping would help?
Yeah, so cups, and I talk about this in the book. When we use glass cups, or we use the hard cups that we're using,
Hmm.
in our clinic, it's harder to put them on bendy parts, right? We don't want curved tissue. Bendy parts, that sounds real medical. But within that, the hard cups tend to lend themselves to larger, flatter
Hmm.
areas. But these silicone cups, the plastic cups that we have that are still hard, some of them are curved, some of them are much smaller. If we were talking about osteoarthritis in the knee or something, what I'd probably do is try and get cups on the quad, cups on the calf to pull blood around the tissue, right?
Hmm.
Gravity will take over and it'll flush the knee eventually. So, yeah, we can use it for that. And if you have the right cups, you can actually probably get them on or around the knee.
And you have done that.
Oh, yeah. Yeah.
Yeah.
Interesting. Yeah, that this is fascinating because again, I've seen it on Instagram and I see all these people
Oh,
all
yeah.
bruised up and it looks crazy. Does it hurt? I feel
No,
like
the bruises should be completely painless. I mean, that's the weird thing, right? It looks like hell. It looks like you stood in front of a pitching machine.
yeah.
But, normally the relief for a lot of stuff, especially if it's just like workout stress or workout tightness, is almost instantaneous, right? The cups go on and people start feeling the change. When the cups are off, those bruises actually have a secondary effect where your body has to keep bathing that area in blood to clean up the bruises, to heal those capillaries. So you have this immediate effect of this influx of a lot of fresh blood. And then the next few days where that bruise is cleaning up, you keep bathing that area in fresh blood. So it has a long-term effect, which is kind of cool.
Yeah, that's very interesting. How would you say it measures up to lymphatic massage or
So
something to that effect.
I think the intention and the direction that we're going in are a bit different, right? There are some similar outcomes and positive benefits that overlap in both of them. Lymphatic massage is specifically aimed at the lymph system, right? We're going to work the areas where we know those lymph pathways are going. With cupping, this is a little bit more point and shoot. I hate to say that and
Mm-hmm.
oversimplify it, but if you say, "Oh, this is the tissue that's bothering me," well, I want to get cups in and around that area. And as opposed to even acupuncture, where acupuncture, I'm trying to find, the dead center of a three-dimensional bullseye that we call an acupuncture point. Cups are a little bit more horseshoes and hand grenades. If I'm in the area, I'm doing good.
Hmm. That's
Right.
interesting. Because obviously we are a weight loss show, weight
Yeah.
management, and I definitely want to touch like how this can possibly
How,
assist
how this, yeah.
in that.
Yeah.
And I also want to get an idea of frequency, like how often are we supposed to be cupping?
So this is if you were like some people really like cupping and they want to do it every day, and that's overkill. Now, if you're going to cup the knee at one day and then you're going to cup another part of your body, you can do that, right? You can change it up, almost like working out. Like I'm not going to hit the same muscle groups every
Leg
day.
day.
Yeah, exactly. So when those bruises are starting to clear, that's when you have like the ability to go back to that area. So some of that's going to come down to people's circulatory system, right? If they bruise easily and the bruises last a while, well, a little bit longer in between those cups. I've had some patients where it might be 2 weeks before they can come back. And then I have some people that don't bruise that much, right? Their cardiovascular system is pretty healthy, their blood vessels are pretty healthy, and they might come back, maybe once a week. And it also depends on the severity of the condition, how well they respond to the treatment, right? Like if you get the treatment once and you're good to go, well, that's fine. Come back when you need me. And the same goes for if you're doing it at home. Now you want to focus a little bit more on weight loss. I'm going to mention that like calming you down, getting you out of that fight or flight, lowering the cortisol. But also when we get you out of fight or flight, your digestion improves. Rest and digest is on that other side, that parasympathetic nervous system. The other thing that we can see, if people have constipation, diarrhea, we can cup on the abdomen, we can cup on the lower back where the intestines are and help improve those functions, right? Getting more blood to the intestines to allow the intestines to heal. I mean, leaky gut, hyper, intestinal permeability is a big issue. SIBO is a big issue. Certainly, we're not going to be killing bacteria in the small intestine, but if we're doing a SIBO-based diet or we're taking medications to help that, getting that blood flow there is going to bring that medication there even stronger. So, in a roundabout way, we can kind of help with the weight loss journey as a piece of restoring some of the physiological function.
So, also what you're saying is it lowers blood sugar.
No, I wouldn't make that claim. I have no studies to say that,
Okay.
but what I would say is improving overall digestion, right? And
Mm-hmm.
certainly some of that may be glandular in effect. If we get you relaxed, we know that your glands are going to run better, and that's going to be pancreas in that case. So I can't make the direct claim that it would lower blood sugar. That would be suicide for me. I'd end up getting a phone call from my board.
Does
But with
it
Go ahead.
benefit the thyroid?
This is another area where you don't see too much cups like over the front of the throat. You do see
Right.
some on the back of the neck. Um, I would say if we're looking at it more from an East Asian medicine
Mm.
perspective, we don't even talk about it. There's no thyroid channel. We talk about digestion as a whole unit, and thyroid
Ah,
is part
okay.
of that,
Okay.
right? So we would be
Mm-hmm.
working more with, in Chinese medicine, the spleen and stomach meridians. And those are on the front of the body, the abdomen,
Right.
as well as the legs.
Okay. Um, so what type of conditions do you see that people could benefit from the
Yeah.
most?
Number one is musculoskeletal pain. We definitely know that. I do a lot of cupping for joint pain as well. It's a little bit trickier. Number one area is probably the shoulders for that, right? We can get a lot around the cap of the shoulder, on the deltoid, on the trap, on the scapula itself. But we do work on knees. We will work, neck and low back pain. I can say there's plenty of systematic reviews that show absolutely this has a positive benefit for that. these roundabout things that we're talking about, traditional use, digestion, allergies, uh, the clinical evidence, the studies are not there, but the historical use has been there for thousands of years, and certainly there's plenty of case studies throughout history that would show the positive benefit for that.
Can I ask you, so in this movie,
Yeah,
they were cupping and they did the fire cupping
yeah, yeah.
and leaving like burned areas on the skin. Is that so?
Absolutely, that is not how it's done.
Okay.
That is no, we
That's
definitely
the
burning the
movies.
patient
Yeah.
is wrong. It's funny because when I was teaching this at an acupuncture school in Manhattan, there was a lot of international students, right? So there was always a little bit different twist on how it was done. So
Okay.
we have in our clinic we use a fire wand, but some people take an alcohol soaked cotton ball and hemostats, right? Locking, tweezers essentially. Uh, light that on fire, put it in the cup, and then put it down on the body very quickly. My Italian students would tell me that, oh, grandma used to put a big coin on your back with a little piece of cotton soaked in some alcohol. They'd light that on fire and then put the cup over the coin. So the coin itself was the barrier so the patient wouldn't get burned.
That's
In
amazing.
Syria, yeah, in Syria,
I'd
they
be
would
like,
make the
no, thank
cups
you.
longer. But within that, if the cup gets hot, that's bad. Especially if you're using glass. Glass is a poor
Yeah, that's what
insulator
they
of
were
heat.
using. Yep.
Yeah, so either that was bad technique or it was just somebody that knew what cupping was but didn't know how it was supposed to be done. You mentioned movies. It's so funny. Even in the book, I reference The Godfather Part Two. Fredo is an infant on the kitchen table with Nona coming over and putting a cup right on his sternum. They always said he was sickly as a child. He always had
Right.
these lung diseases. Uh, Zorba the Greek does it in what is that? That's in the 60s. That's another movie from
Oh.
that time frame. And then I was doing an interview with a woman who said, "Oh, Roman Polanski did a movie," and I'm like, "Yeah, I'm not gonna talk about Roman Polanski." But within that, yeah, he was this vampire hunter movie. He has his assistant do cupping on him, but
Oh, geez.
no, you should definitely not get burnt.
Yeah.
And even in the book I wrote, we talk about the modern cups that don't need that, right? There's even battery powered pumps. They got one way valves on them. You press a start button and it creates the suction without any fire. And we don't have to worry about the cups breaking either. So it's really accessible. And a lot of these tools, you hop on Amazon, eBay, Temu, you name the online vendor, and you will find thousands of options. And a good
Interesting.
a good set could be well under $40, and you take care of it, it'll last you a lifetime.
I'm glad that you brought it up. That was actually my next question anyway, is the possibility that to do it yourself is kind of
Yeah,
fascinating.
yeah,
So like how does
yeah.
that work? What does that look like?
So yourself, depending on where you're going, you're probably going to need some help if you want to work back, because you have to be able to reach around. It's funny, some of the kits tried to overcome that by putting this hose in between the pump itself and the cup, but still you're limited to how you can, move your body to get to that spot. I taught my daughters, now they're 15 and 11, but even when she was 5, I was having her put cups on me.
Wow.
Yeah,
And
that's incredible.
Yeah, it's super low tech. It sounds very fancy, but now I'm looking around my room. I know this is an audio recording, but literally the suction cups, it looks like half a tennis ball or half a handball, and you literally just squish it down on the surface of the skin to get it to adhere, right? And push the
Mm-hmm.
air out.
Right.
So super low tech, but very effective. The other reason I like those is those tend to be milder. So if people are afraid they're going to overdo it, it's very hard to do with the silicone cups.
yeah, I guess
That's great.
yeah, no, it is really great actually. I guess again seeing it on Instagram and you see a person who has like
Yeah, yeah.
5,000 circles on their body.
So look,
You
I
know,
did. I took a photo, right? I saw this photo online, and I was sitting there. I had a break. There was a massage therapist there, and we're looking at the photo, and I'm like, I'm bigger than that dude, and we have more cups. He's got about 30 on his back. We got 50 on my back. fire cups.
Uh-huh.
But it was for a photo. It wasn't therapeutic. The funny thing was, right, your skin only has so much elasticity. So, they're putting them in rows across my back. By the time they got halfway down my back, my skin was so tight that ones on the top were popping off.
Oh,
Oh
wow.
boy.
So we made it work, but it was really for the photo. So sometimes you'll see people doing crazy stuff like putting fish bowls on people's back. I can't say that's therapeutic or not. I think that's more of the showmanship of it, right?
Yeah,
A
exactly.
lot of people who are treating in Asia, right? They may not be clinicians. They may be somebody on the street corner, right? And it's more about I don't want to call it snake oil. Like there's some therapeutic value in it, but like, they're just trying to make a living, and
Hmm.
I'll do whatever because it looks crazy, you know.
Mm.
But real cupping, you don't have to have circles all over your body. You can be pretty targeted and do a few in an area, especially if you have some anatomy knowledge of muscle groups and things like that. What makes sense in your head is probably the way you're supposed to do it.
Yeah, and you see celebrities and athletes doing it now, which I'm sure has changed the perception of the industry, right?
A 1,000%.
Yeah.
I think the first celebrity I saw do it was Gwyneth Paltrow, and it must have been like 2000. I want to say 2004 or something. She was at a red carpet event with cupping marks on her back, right?
Oh
And
no.
yeah, and it's funny because the next day I took my sign off the the shingle down, and I took it back
Right.
to the sign maker, and I said, "Could you put cupping right there?"
Yeah.
Like I didn't have cupping
It's a
listed as a
thing now.
service.
Yeah.
Well, and then even the day after Michael Phelps swam in 2016, our local ABC News was recording in my office about cupping, right? He's a hometown hero, here in Baltimore.
Wow.
So, and it was funny because I go, well, you guys didn't see it, 4 years earlier when all the Asian swimmers were running around on the pool deck with the cupping marks. You
Right.
know, they didn't say anything about it. All the acupuncturists, anybody that was performing cupping knew it. And I guarantee you the conversation with Michael Phelps and all the other countries' athletes were like, what are they doing? To the athletic trainers. And then the,
Yeah.
the athletic trainers had to go out and learn how to do that. So this resurgence, and I'm really keen on this. And as I've been practicing, God, 24 years now, what traditional therapies have we left behind? And it doesn't even have to be from Asian medicine. It lights me up when I can go, hey, no, there's some science behind this and there's some real clinical
Hmm.
value. And how can we bring this back in a way that doesn't look like, oh God, I think you guys are both younger than me, but Steve Martin did this sketch
No,
on,
you could be my son.
so Steve Martin in SNL in the 70s did a barber sketch, and this is back in the day when there were bleeding people. And Lorraine Newman comes in. She's already pale and thin, right? But he's like, "Yeah, let's take more blood out of her." And like clearly she's deficient, right? So bleeding might have some value. Clearly, taking all the blood is very bad. But some of these traditional practices. I gave a lecture to Walter Reed Hospital Systems, right? They do this thing online. They've had me there for a lunch and learn. And I said, how weird can I get? And the doc was like, do whatever you want, right? So I did a lecture on maggot therapy and leech therapy and eating human placenta, which I thought,
Mm.
like, I'm going to weird these guys out. And I showed the modern correlations to it. And they're like, oh, yeah, we use maggot therapy in the clinic. Oh, yeah, we put leeches on post surgical. Oh, yeah, when I explained eating human placenta as a way to get stem cells back into the body, they were like, "Oh yeah, we do that all the time now." You know?
Wow. Yeah, that is fascinating. And I know that, we definitely promised you a 30-minute
Yeah,
show.
that's fine. That's
So,
fine.
but I know, Lori would absolutely want you back as well. And that's actually, I think, the question that I was gonna have for you to wrap up the show and kind of just, of course, get your information, how we can keep up
Sure.
with you, how to get your book, your website,
Yeah.
social media handles, etc. What do you see on the horizon? I mean, cupping came out of nowhere. Like I said, I'm
Yeah.
really fascinated that I love when that, like, I'm similar to you. Like, if I see something that's in the alternative world that catches fire, I'm like
Yeah.
all into it. What do
Yeah,
you
I
see
mean
on the
that's why we do
horizon?
the fire cupping at the office. Like, what other profession do you get to play with fire and it's okay, you know?
Right. So what do you see on the horizon? Is there
So
anything
yeah,
that you think is gonna catch?
I'm really excited. Some people are very afraid of AI. I think it's going to revolutionize healthcare as a whole, even traditional practices. Right? We can get better data. We can get it faster. But I'm seeing this resurgence of classical stuff. The number of times I've lectured to young Western doctors now, and they're like, "No, that's it." And I'm like, "Look, guys, I don't know a quarter of the stuff you guys know."
Hmm.
But they're like, no, this is a better way to take care of patients. So I'm seeing this return to classics, hopefully with this eye that's not blind to the science. That's what scares me. We have some movements that I'm not too keen on because it seems very anti-science. And we know better because this is traditional medicine. And it's like, look, I love traditional medicine. I've devoted my life to it, but you can't, like, if it doesn't make sense, if it hurts people, if you're not looking at the data, you're doing more damage than good. So like I don't want polio to resurge.
Hmm.
That seems nuts to me. And I sound like a lunatic to some of my friends, and I'm like, you guys are anti-science.
Hmm.
You know, so hopefully there is a return to classics, but with this modern look at research, and we're going to see so much. I mean, healthcare was already moving at a mile a minute, where they say things like, if when you graduate from med school 6 months later, half the stuff you learned is outdated. I'm saying that's probably at 75% now. And we see medicine coming out quicker than people are going to be able to even know what it is, right? It's going to be a new discovery every second.
Right, right. Yeah, no, interesting. I definitely, like I mentioned, want to have you back.
Oh, I'm more than happy to.
This would be great to expand on that just in the healthcare system itself. But yeah,
Yeah.
at this point, just give us your
Give
social,
you,
all
I,
that good stuff so we can keep up
yeah,
with you
yeah.
until we get you back on.
So I'll hit you with two websites, and they list everything. So thecuppingbook.com, I couldn't make it more direct. The book is called The Cupping Book. Thecuppingbook.com is where you can learn more about that. And then my clinic website has everything about me. If people want to book me for lectures, if people want to get the book, they can even get a link through there. But Charm City Integrative .com, Charm City Integrative. Charm City is the moniker, the happy moniker for Baltimore. Integrative is we do a lot of different services. Some of them are new, like cutting edge stuff that have been around for 40 years anyway. Just took people a while to catch up. But all of that is listed on my website. If you're in Baltimore, we'd love to have you as a patient. Look us up. So, but you can contact me there. I'm happy to answer questions if people have them. So yeah, reach out.
Love it, love it. All right, Dr. Tom, you was fantastic, and we
Oh,
will have
thank
you
you so
back for
much.
sure. And
Oh,
yeah,
definitely.
have a great rest of the day.
All right, take care.
Thank you so much for listening to this episode of This Podcast Burns Fat. We're so excited to have you as a listener, and we're hoping that you really enjoyed the content as well. And if you did, please run over to iTunes and provide a rating and or review. It will go a long way in helping us continuously build our listenership up so that we can provide you with excellent content regarding fat loss, weight management, and just an overall healthy lifestyle. Thanks so much. Have a great night.